If it is just dollar versus dollar value on paper, the nurses' base salary in public hospitals in Australia is higher compared to the salary of nurses working in public hospitals in New Zealand. However, job satisfaction is not just about hourly rate, there are nuances to it: work environment, nurse-to-patient ratio, ward culture, organizational management, leadership, and life outside of work, such as your extended family, friends, and community. On my previous video, I compared the salary and penal rate of nurses working in public hospitals in New Zealand versus Australia. This podcast is an extension of that, focusing more on my personal reflections. I have divided this content in Part A and Part B. Part A: salary, penal rate, allowances, retirement contribution, and tax. Disclaimer: this discussion is based from my personal experience and a publicly available document at time of recording. Please check your enterprise, contact your employer or HR or your nurses union to confirm your entitlements under your contract. In New Zealand, the salary of nurses in public hospitals, it's under 1 mecca, and it is the same even if you are working in a tertiary hospital or in a smaller hospital. The difference in pay will depend on the years of experience and the actual hours worked. In Australia, the salary of nurses in public hospital depends on the enterprise of that state. On paper, Queensland nurses has the highest base pay. This is when compared to other states in Australia. Well, at least at the time of recording this video. You will remember that on my previous video, we talked about the salary of nurses in public hospitals in New Zealand versus each state in Australia. That included base pay, penal rate, shift allowances, weekend pay, and public holidays, professional allowances, retirement contribution, and tax. And I have specifically mentioned that the Mecca in New Zealand or Enterprise Award in Australia gets reviewed and the wages are negotiated from time to time. So, for example, the multi-employer collective agreement in New Zealand is up for negotiation this year, so hopefully there will be some improvement with the nurses' pay. Similarly, in Australia, as far as I know, New South Wales, Victoria, Northern Territory, Western Australia, Australian Capital Territory, and Tasmania are also negotiating their enterprise this year. And then for Queensland, the current enterprise will expire in 2024, and for South Australia, it's until 2025. Wages, salary. So the base pay in public hospitals in Australia, again, at least on paper, is higher than the base pay in New Zealand. Depending on which state you are working, the penal rates can also be higher. So for example, in some state, if you are working on a Sunday, you can get time and 3/4 or double pay instead of just time and a half in New Zealand. Another example would be for night differential. In some states in Australia, you get this penal rate from 6 p.m., but in New Zealand, you'll get this from 8 p.m. However, I must say, if you work on a public holiday in New Zealand, you will get double pay plus lieu day. But in some states in Australia, public holidays are only paid time and a half, and you don't accrue a lieu day at all. Now, don't get me wrong, there are other states in Australia which pays holiday rate at 200% or 250%, depending if the public holiday falls on weekdays versus weekends. But in some states, most of public holidays are paid time and a half, with the exception of Christmas or Easter, for example. It gets paid 200 to 250%. But again, in Australia, at least as far as I know, we don't really accrue lieu days when working on a public holiday. If I am not mistaken, in New South Wales, you can choose to either get paid public holiday rate or accrue leave hours instead. However, if you are working full-time in Australia, as far as I know, full-time workers are eligible to get ADOs or allocated days off. So for example, with my previous role, I was working full-time at 38 hours per week. But because of the health service operation hours, I still worked 8 hours shift, 40 hours a week. However, this means that I was accruing ADOs. I think I get 4 hours worth of ADO a fortnight, so every 2 weeks. So in a month, I get 1 extra day off, and that's paid. In New Zealand, full-time hours is at 40 hours a week. There's no ADO, but like I said, if you work on a public holiday, you can accrue leave days. By the way, if we're just meeting, kia ora, my name is Binibining Veronica. Welcome to the Little Cup from New Zealand to Australia, where I help people prepare for their big move abroad. So if you're moving to New Zealand or Australia and you want to plan better, then please hit like and subscribe. Salamat po! Now, let's talk about professional allowances. So in my experience, there were some allowances that I qualified for in Australia but not in New Zealand. So for example, even if I had an expert PDRP in New Zealand and a master's degree, I didn't get the PDRP allowance at all because I was working on a senior designated role. So I only got the base pay for nurses. But when I moved to Australia, specifically in the state where I am working right now, I am receiving a professional allowance. This is twice a year pro rata, and the actual amount is slightly higher if you are working in a regional area. I didn't have to do further training for this allowance. This is just part of our enterprise, and I am also getting a qualification allowance every fortnight for my master's degree. I will not talk about the actual dollar value in this video because I have discussed that in detail in my previous video, so please check that in the playlist above or the link below. And for your reference, we also have fortnightly laundry allowance. It's not much, it's also pro rata. I think I get about $4 a fortnight, but you know, it makes me happy. And despite not getting PDRP allowance in New Zealand, I am still very grateful because, as I have shared to you in the past, I completed my master's degree for free. I got a funding for it, and my manager supported me throughout the whole experience. I have learned a lot, met amazing people, and it also opened up other opportunities for me. Retirement contribution. If you just joined the workforce, I urge you to start thinking about what retirement looks like for you. How will you support yourself financially once you are no longer working? So this could be because you chose to fully or semi-retire on a certain age, or perhaps life just happened and now your ability to work full-time has diminished or decreased. But anyway, public hospital employers in Australia contribute more towards superannuation funds versus New Zealand. And if you don't know, KiwiSaver or superannuation get taxed too. So obviously this is not a financial advice. I am not an accountant, but as far as I know, in New Zealand, depending on how much you earn and your PI income, the prescribed investor rate is at 10.5% to 28%. And just a reminder, please check the website of Inland Revenue Department for more details. Now, for Australia, I believe the earnings on the investment within your super fund are taxed at 15%, but I will also include the link to Australian Taxation Office so you can look it up further. Please check the description box below. And before we talk more about tax, if you are enjoying this video, please hit subscribe and turn on your notification bell so you will know when I upload new videos just like this one. And if you want to support the channel, click that super thanks icon at the bottom of the video, or simply buy me a coffee by clicking the link below. Alternatively, a big thumbs up also goes a long way. Salamat po. Tax, again, this is not a financial advice. I am not an accountant, but as far as I know, in Australia, for tax residents, you don't pay tax for the first $18,200 of your individual income. And then in New Zealand, you get taxed if your income is over $14,000 and it has a progressive or gradual tax rate. In Australia, if you are working in a public hospital, you also may qualify for a salary packaging, which means your employer pays the same salary, but your pay for selected expenses is taken out before tax rather than after. There is a limit to this, so for most public hospital, it is usually around $9,000 per year. However, you will have to check with your nominated provider to verify the details. In Australia, you can also claim for deductions. So at the end of the financial year, some of the deductions you can claim includes membership accreditation fees, union fees, and education, training, and seminars. In New Zealand, you can get reimbursement for your council registration through your employer if you are working in a public hospital. And then you can apply for funding for education, training held outside the organization on a case-to-case basis. However, unfortunately, you cannot reimburse your union fees in New Zealand. Now, I will add the link to IRD and ATO in the description box below, so please check that out. Now, let me share my reflections about Part B, work environment and ward culture. Work environment, it is really difficult to compare, I think, because I am still new to Australia and it is such a big country with different states. It is very challenging for me to make a generalization. Unlike in New Zealand, where I can make my foolish assumptions based on the limited 10 years I have worked there. However, how I summarize it in my head, wherever nurses work, it is sadly a challenging work environment. You know, I feel privileged to be in this YouTube space where I can talk to nurses in different parts of the world, Middle East, Singapore, UK, Ireland, Germany, and sadly, ang hirap talagang maging nurse. It is difficult to be a nurse. The nurses I talk to feel undervalued while always being pushed to give their 110% each shift. But in my foolish generalization, if I would rank it based on my personal experience, for me, it is most difficult to work in a public hospital in the Philippines. Then second place would be New Zealand and then Australia. But that is just for me and my experience. Because like I said, there are different public hospitals in Australia, from big tertiary centers to outback rural setup. I also have talked to other nurses who moved to Australia and returned to New Zealand and said they are never going to work in Australia again, and it was simply not for them. Alright, now back to my personal reflections. In terms of the actual workload in Australia, at least in the state where I am working, it is usual to do team nursing. So for example, in a medical ward, there's 2 nurses allocated to 8 to 9 patients. I think it's usually 8 patients, but sometimes it can be a 5 and 4 allocation if the ward is really short staffed. Your partner may be another registered nurse or an enrolled nurse, so you end up with 4 patients each. In a ward, they also have a discharge planner facilitating complex discharges. They don't have patient workload per se. And then there's a team leader. Usually, they are not allocated the patient workload as well. And they help with coordinating the shift, facilitating planned discharges, and they also provide extra help for the nurses on the floor. Nurses in a team leader role are in a different pay scale, so they are at the clinical nurse level. I didn't include their pay rate in my last video, but just know that they earn more because they have more responsibility and they are more experienced. CNs also work rostered shifts, including PM, nights, and weekends. And then obviously on a morning shift, you have your nurse unit manager. And in terms of educational support, the wards have access to a clinical nurse facilitator and a clinical nurse educator. Now, respectfully in my head, how I explain it to myself, if nurses are superheroes, CNE is like Batman and CNCF is Robin. They work together in the same education team, but they have different roles, with the latter reporting to the former. On the other hand, in New Zealand, depending on which DHB or ward you will work, you may or may not do team nursing. So for example, in a medical ward that I know, it can be a team nursing approach. So 8 to 10 patients are allocated between 2 registered nurses. And we also have healthcare assistants. In New Zealand, we don't really have a lot of enrolled nurses in public hospitals, so it is more common that you are working with another registered nurse, and then you have healthcare assistants supporting with cares and ADLs. So from memory, when I used to work in a 34-bed unit in New Zealand, depending on acuity, we may be allocated 3 HCAs in a shift for the whole ward if we have enough staff. But where I am working right now here in Australia, some of the medical wards I know only have 1 AIN, assistant in nursing. And I believe that's only in the morning shift. But again, this will vary depending on the actual state, how big the hospital is, and the acuity of the ward. Because I have talked to other nurses who said they always have at least 1 AIN per shift in their particular hospital. And for your reference, AINs are the equivalent of HCAs in New Zealand. Also, in my experience, if you have a patient requiring one-on-one supervision, there's a different AIN allocated for that task. So this is in Australia. And then if you have patients with extremely challenging behavior, the security team can also support the nursing staff for however long it takes to de-escalate the situation. And this is something that I really appreciate, because when I was working in New Zealand, even though we can use the duress button or phone for security staff, although they are very supportive, we are always mindful that they can only be there for us for a limited time. Depending on how big your hospital is, on an afternoon and night shift, the number of security personnel may also be limited. And then back to the team structure in New Zealand, on a morning shift, you will obviously have the clinical nurse manager. If it's a relatively bigger ward, you can have 2 nurse manager or 1 nurse manager and 1 associate clinical nurse manager. And then after hours, you will have your team leader for your ward. In New Zealand, we call them shift leaders. They have their own workload while they are also supporting the rest of the team. When I get assigned as a shift leader back in my day, I did not enjoy the experience because it was really stressful. Usually, the shift leader is the most senior nurse on the ward, or if, for example, there's more casual nurses versus regular staff, that regular staff may be tasked to coordinate the shift. They do try to allocate the less acute patients to the shift leader, but it just really depends. And even if you are the shift leader taking on these responsibilities, unfortunately, you don't get extra payment for that. And in terms of education support, we don't have a clinical nurse, clinical facilitator role in New Zealand, so it will just be the nurse educator for that ward, and they don't usually work full-time. In terms of overall patient acuity or how unwell your patient is, I think it will matter more depending on if you are working in a tertiary hospital versus a secondary hospital, or if you are working in an acute versus subacute unit in which the nurse-to-patient ratio may be different. And then let's also briefly talk about documentation. As usual, there is a lot that we document as nurses. You already know the drill. But I'll just let you know, most of public hospitals in Australia are currently using or will slowly transition to electronic documentation. We are still not using this where I am working at the moment, but I'll keep you posted. And when I was preparing my notes for this video, I actually started reflecting on some similarities and differences between nursing in a public hospital in New Zealand versus Australia, but I might just save that for a different video to make it less complicated. Please let me know in the comment section below if that is something that you're interested in. And then I have purposely separated the discussion for working in private hospitals and aged care facilities in Australia because I'm not sure how many of you will be interested. So again, just please comment below if that topic is interesting for you. By the way, if you are thinking of moving to New Zealand or Australia, I have a free nursing career abroad planner that you can use. Just click the link below. We also have a Tagalog group chat and you are more than welcome to join our chikahan. Ward culture. Again, it's difficult to make a generalization about this, but I can say 2 things. Number 1, I have been very fortunate to have worked in relatively healthy work environments. It wasn't perfect. There were people I didn't get along well. There were challenging behaviors from nursing staff I worked with, and I'm sure working with me wasn't paradise either. But despite all of that, the good outweighed the bad. I cried a lot, but the overall experience for me was mostly positive. Having said that, number 2, bullying in nursing is real. It is unfortunately well and truly alive. It is difficult to navigate. It is never straightforward. This is something you will have to escalate with your nurse manager or even HR. They may also talk to you about using employee assistance program that's available in New Zealand and Australia. You may also want to reach out to your nurses union. If you are a migrant nurse, I cannot stress this enough. For me, being part of a strong nurses union is worth every centavo you are paying. In Australia, you can even claim this as deductions at the end of tax year. So for me, joining a union is worth it. Now, for your reference, in New Zealand and Australia, you also need to have indemnity insurance, and you can get this through your nurses union. I pray that you also have people outside of work who can help you emotionally and spiritually. Before I jump to community, in terms of organizational management, leadership, again, I have been fortunate to work in hospitals which are not too big in a sense that you are forgotten as a person. With the public hospitals that I worked in New Zealand versus Australia, the doctors were generally easy to get along with. I am still new in a way here in Australia, so maybe I feel closer to the doctors I worked with in New Zealand, but I think it's only because I've worked with them longer. You know, I've attended Christmas dinners with them, work too. In some instances, I've attended their wedding. I've invited my colleagues to my wedding, my baby shower. So yeah, by the way, random story. One of the consultants that I used to work with gifted me a mattress for my daughter's cot. It used to be his daughter's mattress, but there you go, I saved some dollars. Then my nurse managers in New Zealand were really approachable, and when I first moved to a senior designated role, I worked as a nurse specialist and reported to our nurse director, and she was so welcoming. I can come to her office and just say, "Today I give up," and just vent out. Even with my workplace now, my boss is also very approachable and pretty laid back, so happy with that. Now, I am sharing these feel-good examples while also being mindful that most nurses at the moment are really exhausted and frustrated. And when you are working on the floor, if you are always short-staffed or if there's an appropriate skill-mix ratio, it is really stressful and it can eat you up. All those worries, you take it all home with you. That's why it's also important to find a supportive tribe, your community. I think throughout this video, there are some aspects which are better here in Australia and some things which are comparable or somewhat better in New Zealand. But what I miss the most from New Zealand is the relationship that I have built. As someone who moved from New Zealand to Australia, I can say that the first year was really challenging. You miss your old team, you miss how settled you were in your role. Especially if you have established your reputation in your ward or organization. It is really mind-numbing to move to a new place, adjusting to the quirks of other people, getting used to the work routine and culture. By the way, in the room where I shoot these videos, I am surrounded by presents from other educators who I used to work with in New Zealand. I have a coffee mug, coaster with my initial, and a blanket which was knitted by one of my workmates. I also have this Ponamo from my previous DHP, and I wore this during my first week at work here in Australia. I am not sure if it's across all public hospitals in New Zealand, but in the public hospital where I was working, if you were employed for over 5 years, you are gifted a jade pendant, a Ponamo, when you resign or retire. My Ponamo is special for me. It reminds me of the friends I made in New Zealand. Personally, it also reminds me of the things I never thought I'll be able to do or overcome, and I'd like to think that this Ponamo keeps me grounded amid all the chaos. I have struggled a lot with our move. I struggled at work, at home. There were always things that needed to be done or done better, and I couldn't find peace. What helped for me at home was prayers and lots of prayers, talking to my family in the Philippines, talking to my friends in New Zealand, and also I'm grateful for my husband and daughter. Sabi ko nga sa kanila, please cooperate. And thank you for cooperating. At work, I was lucky that our team leader was very skilled and kind. This was for my first job in Australia, and there was also another nurse facilitator that I admired a lot who was genuinely helpful. But before I settled into that relationship, like I said, I was wearing my Ponamo around my neck, and sometimes I'll keep it in my pocket, touch the etching, ewan ko ba, feeling ko talaga may magic to. I feel like it's giving me some sense of peace anyway. Because I struggled a lot initially, and right when I was finally feeling settled, I had to change job again because of another career opportunity, and we got our first home here in Australia. So with a new job, it also meant I don't have to drive that far for work. Oh, by the way, in Australia, if your contract says that there's a probationary period of 6 months, do take that probationary period seriously, because I know of an enrolled nurse and registered nurse whose contract ended after the 6 months review. But this happened in a private hospital and an aged care facility respectively. I don't know much of the details, I just know that it happened. I haven't heard from anyone who experienced this in a public hospital, but if you have and you are comfortable, you may want to share it in the comment section below, as long as it's not breaching someone's privacy. Question of the day: given the opportunity, would you rather move to New Zealand or Australia? Let me know in the comment section below. And if you think this video is helpful, share it. Share this information to a friend and check out my podcast about moving from New Zealand to Australia. As always, I wish you all the best with your journey, and I hope you will be blessed. I'll see you soon. Bye!